Good morning. Good morning, everyone. This is Dr. Yolanda, and you are here on blackdoctors.org with me and a very special guest. So today's show on mind, body, and stress with Dr. Yolanda, we will be discussing just a little bit about breast cancer. I'm only going to talk a little bit about it because I'm more interested in having you all meet someone very special to me who is a breast cancer survivor. So we know that October is Breast Cancer Awareness Month. And for those of you who know me, I don't wear pink much, but I am all out in October doing my pink, wearing my pink, bringing awareness. I even have pink on my nails, bringing awareness to breast cancer awareness because it is so important, or actually lending my voice to breast cancer awareness because it's so important to talk about. So if you're here and you're joining us, let us know where you're here from. Go ahead and tell us in the chat where you're joining in from, because we just won't know. We have viewers from all over, so it's good to know where you're joining in from. And let us know that you're listening. And if you have any questions, if you know anyone who has been diagnosed or you've been concerned about your own chances or risks, then this is an opportunity for you to get some more information. So, many of you may not know this, but breast cancer is the most common cancer in American women. And that's except for some skin cancers that are actually very prevalent. The other thing to know is that it's estimated that in 2023, approximately 30% of all new female cancer diagnoses will be breast cancer. The fact is, 1 in 8 women, or approximately 13% of the female population in the US, will develop breast cancer in their lifetime. So what does that mean? About that, on average, every 2 minutes, a woman is diagnosed with breast cancer in America. That's a lot. And approximately 64% of breast cancer cases are diagnosed at a localized stage, which is probably the most important thing to know. So before the cancer has spread in any other part of the body, because that's something about cancer to know, that what it does is it may start in one place, but if gone undetected and untreated, it has the tendency to do what we call metastasize, which means it goes to other parts of your body, travels through your lymph nodes, through your lymph system, and it can get to other parts of your body. But the good news is that 64%, which is much more than half, it's a good number of breast cancer cases are diagnosed at the localized stage before it is found in any other part of the body. This is extremely important to know, which is why early detection is something that we want you to be aware of. And what is early detection best done by is self-examination. Knowing what you're looking for, doing your own exams on your breast at any given time. It can be monthly. You can choose what that time of month is. Some people address it and do it during their cycle. Obviously, women who stop having cycles, you want to do it once a month. I saw someone's pop in. They're here from Louisiana. Thank you for joining in. I'm going to be back in Louisiana this weekend, so good to see you in. The other thing to know is that the 5-year relative survival rate for breast cancer diagnosis is localized. At the localized stage is 99%. What does that mean? That's extremely high. That if you get it at the localized stage, then after 5 years, that person is still with us. They've survived breast cancer. They've had the opportunity. Most likely they will have survived. So that's 99%. That's extremely high. So that means the earlier we detect it, the more likely we are to treat it completely and have someone live well beyond into their later stages of life. So what do we need to know? On blackdoctors.org, we often talk about not just disease processes, but how are we often in our populations, in our communities, disproportionately affected. So breast cancer in Black women, there's a lot to know. There's a lot to talk about. The average age for detecting breast cancer in Black women is 60 years of age. Compare that to 62 years of age in our white counterparts. So it's found earlier in Black women than it is in white women. The other thing is that's extremely disheartening is that Black women are 40% more likely to die from breast cancer than our white counterparts. So this is the part that we have to really work hard against. We have to detect it early. We have to detect it while it's in its localized stage so that we can eradicate it much earlier. So if it's not found until often age 60, that means that often it's earlier in our lifetime that we should be checking for and aggressively looking for these signs or symptoms and advocating for ourselves when we think anything's wrong and talking to our doctors. Black women also, I talked about that, what we call that 5-year relative cancer survival rate. That's 99% when it's found localized. Well, guess what? Black women have the lowest of that 5-year relative breast cancer survival rate of any other racial ethnic group, not just white women, but when we're compared to any other race, we have the lowest survivability. So that means we have to find it early, we have to do early detection, and we have to be aggressive in our treatments. 1 in 5 Black women with breast cancer are diagnosed with something that's called triple negative breast cancer. And the problem is, triple negative breast cancer is the hardest to treat. And this is higher for us and Black women than any other racial or ethnic group. This is often why we may have the lowest of that 5-year relative cancer survival rate. A diagnosis of triple negative breast cancer means that the 3 most common types of receptors known to fuel most breast cancers, which are estrogen, progesterone, and something called the HER2 NEU gene. And I think we have a graphic here. So the most common are those 3 receptors. They're not present in the cancer tumor. And the problem with that is that a lot of the treatments that are used are directed toward these receptors. So if you don't have these receptors, and often the medications are, the hormones are directed at treating these receptors, then the medication doesn't necessarily work. So if you have this triple negative cancer cell, then the medications, some of the common medications, do not effectively work because they cannot connect to those receptors. Since the tumor lacks these necessary cells, these treatments like hormone therapy and drugs that target estrogen, progesterone, and HER2 are ineffective. So using chemotherapy to treat this triple negative breast cancer is still an effective option, however. That means that, again, early detection, knowing what you're treating, knowing what genes you may have. We know about BRCA genes and things like that, but we have to also know about this triple negative tumor. So I'm not going to belabor the point. I just wanted to talk a little bit about what breast cancer is. Here's the other thing to know. Women are not the only people in this world, on this planet, that can get breast cancer. So statistically, there are cases of breast cancer in our men. Young men tend to have something called gynecomastia that they're often concerned about. It's when their hormones are just starting and they are going through puberty, and they may have a lump that is under their areola, and it's a little tender. They may have it on both sides. This is not associated with breast cancer, but it's often the only time that men are concerned about what is considered like their mammary glands in their breast area, right? Because we don't necessarily think of breast in men, but they have all the hormones in their bodies very low that could be connected to breast cancer. They have the glands, they have the structure, the biological structure. So it is possible for men to get breast cancer. So we want men to know about breast cancer as well, and we want men checking. So we're going to talk now to a very special guest who is a breast cancer survivor. And I have a couple of questions for her, but I'm going to have her talk to you, tell her your story. And again, if you're here from wherever, shout your city out. Tell us where you're joining in from, because we want you to be a part of this discussion as well. We want to make sure that you're getting all the information that you need, because again, October is Breast Cancer Awareness Month. So I'm going to invite in someone who is a breast cancer survivor to tell a little bit about her story. And I wanted to honor her on the show today. She's been doing a lot of work in the community, in her own local community and nationally, to get not only her story out, but just to be an inspiration for others about breast cancer awareness, and just how to approach challenges in your life. How do you face challenges in your life and keep going? So with that, I'm going to introduce to you Miss Ruth Redmond, who is joining from, well, actually, Ruth, let us know where you're joining us from today.
Sure. Good morning, everyone. Again, my name is Ruth Redmond, and I'm joining you from White Plains, Maryland.
She is in Maryland. So we are in the DMV. I'm actually in Washington, D.C., and she's in Maryland. So we are coming to you live from the DMV. And we are, again, just wanting to bring awareness. And I want to honor Ms. Redmond for her journey through breast cancer. So, Ruth, tell us a little bit about when you were diagnosed with breast cancer initially.
I was initially diagnosed in 2015.
Okay.
It was due to a routine physical, and the symptoms that I was experiencing was just loss of weight. I was under a lot of stress, and I just determined that the stress factor was making me cause me to lose weight. But because I'm small frame and stature anyway, and losing more weight, that made me recognize something's not right. So I thought maybe my iron was low, because I also stayed so fatigued a lot.
So you
So
were tired,
yeah,
you were losing weight, and
yeah.
you got a regular exam as a physical. Had you been getting, how old were you at the time you were diagnosed?
Um, I was in my early 50s, because
Early 50s, right?
sorry, I just turned
No,
61.
no, it's okay. Early 50s.
And
And so you were getting a regular physical. Had you been getting mammograms at this point? Yeah.
okay. I'm at that time I was employed with the DC Fire Department, and their rules are we have to get annual birthday physicals. So I had my physical with them, but I still was losing weight. So I said, let me go to my private physician. And here's the kicker. And this is what we females tend to do. And this is also what I speak on. She said, Ruth, you hadn't had a mammogram in 4 years. And I'm like, I know. See, we always put things past, and it's fear. And to be honest, my fear was I heard that it hurts. And I'm like, I have small breasts, so I don't want you to flatten what I have.
So you were deterred by the idea that it was uncomfortable, a very uncomfortable exam. Had you had any mammograms yet prior to this?
Not since those 4 years. Nope.
Right. So you had one, and it had been 4 years.
4 years.
But my
It was,
question is, had you only had the one, and then you just hadn't had one again, or had you had a few before you stopped having them?
I had a few before,
Okay.
and then I
And
just
so
stopped.
they were all just so uncomfortable that you had decided you'd rather not have the mammogram because it was so uncomfortable. And this is a good conversation to have, because we need to talk about what are the things that we need to do, right,
Mhm.
to manage our health, to monitor our health, and what are the benefits, like the costs, and like the pros and cons, I guess we should
Mhm.
say, right? So the
Right.
pros are you're managing, you're monitoring, you're staying up on it. The cons are it's uncomfortable, it's not convenient. Sometimes people
Mhm.
just can't get the time off. They didn't make the appointment. They're so busy taking care of other people in their lives, they just don't get around to doing it.
Mhm.
Um, and it is unfortunate that an exam that's that important would be a deterrent for some folks because it's uncomfortable or it
Mm-hmm.
might be painful. And so we got to talk about how the difference between, it being uncomfortable, but it being extremely
Extremely important.
necessary.
Mm-hmm.
And you know what? Let's go through it. Let's do it. But the other thing is maybe hopefully with technology, they'll get um more exams that are more comfortable and easier for women because it is extremely uncomfortable. It
Mm-hmm.
is. I mean, I've done it. I do it every year. I actually recently had to get a what they call the diagnostic
Mm-hmm.
mammogram, and it isn't comfortable, but at the
Mm-hmm.
same time, I'm so glad you're here, and I'm glad you're saying this out loud because
Yeah.
there's somebody out there who may have been avoiding their
Mm-hmm.
mammogram simply because, as you stated, they heard it's it's painful or they heard it's uncomfortable.
And the
But we're
thing
here to
was, it wasn't even my insurance because my insurance, would cover their percentage. So I know some people insurance, they have issues with it. I didn't have an issue with my insurance. It was me.
It was you. And
Yep.
I'm glad you're saying it. And this is a good, a space, a safe space, right, to have this conversation because we need to talk about things like that. So you went out, I mean, you had the regular exam
Mm-hmm.
with the fire department, but you said something's still going on. You advocated for yourself. That's another
Right.
piece that we need to talk about, right? You're
Yes.
like, I'm still losing weight. And I'm not doing anything in particular to lose weight. I'm not
Right.
trying to lose weight. So something else must be happening.
Going
So
on.
you got your you got your private doctor,
Mm-hmm.
had a physical, and she said, "Hey, you haven't had a mammogram in 4 years."
The thing is, also, she checked my breast exam. We felt no lumps. I had no breast density or anything. So that's why I figured, go ahead and get it done.
Okay. All right. And
So,
so prior to that, this is good news, right? This is a good
mm-hmm,
conversation because a lot of people think um, the signs and symptoms that you're looking for are
are not always.
lumps,
Mm-hmm.
hard nodules, wrinkling of the skin. There's all of those things, but you're saying you didn't have any of those
No,
things.
I didn't even know discharging the nipples, nothing.
Nothing happened. Nothing was going on
Mm-mm.
with your breast, particularly localized. What you felt was
No,
just you had the weight loss.
right,
And you
correct.
said, this is something's going on. I'm not purposefully losing weight. I'm not eating less or working out or doing anything. Something's happening. I'm losing weight. And
Yes,
so I need to mention this. Doctor said, let's do a physical. And, it's been 4 years. You need to get a mammogram.
yes. So
Okay.
I went and got the mammogram, and they called me back and they said, I need to get biopsies done. So, still in the office, because at that time I was a fire inspector with DC Fire. And I talked to the ladies in the office, and they were like, "Oh, a biopsy is fine. They only do one. You'll be good. You're a firefighter. You can handle it." When I got my biopsy, they told me I had to get five. And that's when I knew something was not
So
right.
there were 5 places that they needed to test
Mhm.
for cancerous cells.
Yes.
So they had to do 5 different biopsies on 5 different. And were all the five?
They did three in the left
That's
and
what I was
two
going
in
to
the
ask. Were
right.
they all in one breast? So it was on each
Hmm.
side.
Yes.
Okay. So I'm gonna process that for a second because I don't want to rush through your story.
Okay.
No, I mean in the sense that this is a whole thing. This is like real life. This was happening to you.
Hmm.
And you've probably told your story enough times that it just feels like, oh yeah, this happened. But that's a lot. When they
It
told
was
you that day that you had 5 different lesions that needed to be biopsied, how did
correct.
you feel?
Scared, very scared. But I also knew that they're detecting something because that's unusual for five. So I have a high tolerance of pain. So I was okay, but not okay. And I was by myself. And we'll talk about that too. I went by myself because I went.
Thinking
Um,
it was going to be routine.
yeah, just routine. Now, to think that I wish I could do something about the breast biopsy table is terrible. It is so hard. I think I read that a male built or he experienced and did that. The table feels like wood. And
Wow.
again, because I have a high tolerance, and because I also was a EMT, I'm not anymore, but I also, before I went in the fire department, I was going to nursing school. So I still was using my medical background a little bit. And I'm always curious because even when I get my blood drawn, I have to look. And so I was curious to see how they're going to do the biopsy because they placed the breast in this little hold on the heart table, but they raised the table up, and the doctor came in, introduced herself, and explained everything. And underneath, she pushed the machine underneath it, and I couldn't see anything. And that's where, like I said, I'm on the table, and she's underneath the table doing what she needed to do, and the breast was in the hole. And she let me know when I was going to feel the little pinch, but the most uncomfortable part was laying on that table because you have to keep completely still.
Mm-hmm.
And I didn't have anything on my neck to help. So after they finished all five, the only reason why I teared up a little bit because the cramp in my neck was so excruciating. It was terrible. But again, I have a high tolerance of pain. So the five biopsies didn't bother me. Still in the back of my mind, I knew something wasn't right, but do what I had to do. And again, even though I waited that long, but I still caught it in time.
Good. Okay, so that's the next part. So, what was your actual diagnosis when they like what type of cancer, what stage, what
Mhm.
type of cancer? What do you remember or recall the diagnosis that you were given once they came back
Yes.
with your results?
A little history on that. I was in Georgetown, Northwest with my daughter, and I saw the doctor had called on my cell, and she said, "Can you talk to the assistant?" And I said, "Sure." So I pulled over, and she said, "I have your blood results." And I said, "Okay." Well, joking, I said, "I know I'm not pregnant."
Your biopsy results? Was it your biopsy results or you had blood work done?
The biopsy
Did
results.
they do?
But
They
when I
they
had
did
the
both. Okay.
physical, I had the blood work done as well. So she was
Okay.
calling me to let me know the blood work was fine. However, the biopsy came back positive for breast cancer. And she said, "So you need to follow up ASAP tomorrow we're giving you the doctor of the oncologist at Sibley Hospital, and you need to call right away." And I, on the phone, I looked at my daughter and I said, "Okay." So I drove home from Georgetown, Northwest to Bowie, Maryland, like nothing happened.
So you hadn't you chose in that moment as a parent not to
Mm-hmm.
indulge, not to tell
Mm-mm.
your daughter what the
Mm-mm.
news was that you had just received, because that's what we are. That's what we do.
Mm-hmm.
We protect our family. We protect everybody. But that means we're going through sometimes we're going through these things by ourselves. Okay.
Well, and I mentioned that again, that distance from Northwest to Maryland,
Oh, it's a long ways.
God must have drove my way because I was there, but I wasn't there.
No. Oh, I there. Yeah. People who don't know DMV don't know, but that's a good 40-minute
Yes.
drive easily. 40 minutes of just mind, racing, numb.
Hmm.
I can't believe I just received. How do you feel about receiving the information on the phone?
I was scared. Again, I put on that facade that, okay, I can handle
Right,
because my
but do
daughter's
you
in the
do you
car.
wish you had been asked to come in for your results, or did you feel like you were glad to be told immediately on the phone at that moment? Because here's what I'm
Yeah.
thinking. This is just me. I haven't had this particular. I've had an experience of a scare with an abnormal mammogram,
Hmm.
and then I actually had to go get a diagnostic mammogram, and I did have to get a biopsy that turned out to be okay. But I remember thinking, if they call me with these results and I'm somewhere, I'm at work, I'm with a patient, like I wouldn't know how to handle that. And I think I'm not sure how I feel personally about the fact that you were on the road in the car, pulled over, got this information, and then just sort of had to get yourself together and continue driving.
Well, she
So
did
how
ask
do you
me.
feel?
She did ask me, "Can I talk?" So I could
Mm-hmm.
have told her no, wait till I get
Okay.
home. Or I chose to say, I guess I
Okay.
was just curious. I chose to say, yeah, I can
Right.
talk.
You kind of wanted to know right
Yeah.
then and there. Okay. And that's fair. And I say sometimes I in this show and just as we as Black physicians, we talk about not only your experiences as patients, but we like to hold ourselves accountable
Mm-hmm.
too, right, as
Mm-hmm.
providers.
Mm-hmm.
And so just making sure that people know, you have to advocate for yourself, and you have to understand and know, and keep us honest, right, about
Okay.
how we deliver our
No
services and how we
service.
deliver
Yes.
information. Because if it was a situation where it wasn't given an option, is
Mm-hmm.
it something that I could talk to you right now? Are you in a comfortable place? Are you by yourself? Do you have someone there with you that, there's all kinds of questions that,
Mm-hmm.
usually we would ask. So I'm glad to know that you felt like she gave you that
Yeah,
option,
she gave it to me.
and you, because of who you are and because
Mm-hmm.
you wanted to know right there, you went on,
Yeah.
received the information, and like you said, somehow got home
Got home,
in
fixed
less
dinner,
than
helped
40
with
minutes.
homework. And when the house was quiet, I went in
Mm,
my room in my walked-in closet with my house phone, called my mother, and just let it all out. And my sister was on
mm,
the phone too. And my mother said, cancer is not a death sentence anymore. And that's what kind of stopped me from bawling. And then I called my other girlfriend and we cried together. I called my sister who was on the phone with me. She called her daughter, my niece. And
mm-hmm.
here's where medical advocacy, it plays a role because she was that on every appointment that I went. I went the next day, met the oncologist. She had outlined um, on her piece of paper, she drew the diagram of where they were located,
Mm-hmm.
what they were going to do. She already said, oh, and your insurance already paid for it. So we're going to give you a mastectomy because the way it is, your breast, if we cut you, it's going to be so disfigured. We're going to give you a mastectomy because you're small frame, so you don't have any fatty tissue to take from your body. And we're
Mm,
going to do a lymphectomy on the right.
mm-hmm.
And I wrote, and they gave me a notebook. They gave me, the notebook included directions, when they want to schedule surgery, the certain foods and spices that they advocate for you to eat and drink.
That's the part I want to get to at the. I want to get to that part because when I start telling people the things that can help you, I'm always talking about nutrition and
Yeah.
how the way we eat is so important when it comes to our overall health. And
Yes.
sometimes we just don't know that we're
Mm-hmm.
eating things that are sabotaging our health, but we're also excluding things from our diet that's actually really, really good for us.
Mm-hmm.
So hold that, put a pin in that,
Okay.
because I want to share some of that with the audience.
Okay.
So she told you about some things to actually start
So
adding to your diet.
yeah, and I was diagnosed stage one. Like I said, even though it was caught on time, but I still took a long time to get a mammogram. Just imagine if I ignored it again and again, it could have progressed. So
Mm,
stage one HER2 negative. Uh, DCIS was ductal carcinogen inside the milk, in the milk ducts, and it didn't
mhm.
spread to other tissues.
Good, good. So these are all good diagnoses, by the way, to the audience. So, what treatment exactly? So for you, you had bilateral
No,
mastectomy.
I asked
Okay,
for a bilateral, and they didn't do it. So I
they
just had
didn't.
the
They didn't feel
mastectomy
like
on the.
they needed to.
Yeah, they felt like they needed it, didn't need it, and I'm just, again thinking on a woman's aspect, not a medical aspect. Is it going to spread to the right? Why didn't you just take both? But they was adamant that I didn't need it.
Hmm,
So
hmm,
I had the mastectomy on the left and the lymphectomy on the right. And when I went to see the oncologist that they referred me to, I prayed hard. Well, I'm a Catholic, so I was definitely praying, and I prayed hard that please don't let me take chemo or radiation. Please let me take a pill. And when we talked for a long time in the office, and he said, you're at that borderline that it can go either way. We're going to put you on tamoxifen.
Mm-hmm.
So I was on tamoxifen for 7 years. Now, according to the prescriptives, when you get it from the CVS or whatever, the directives say 5 years. I'm like, why is he? I'm still on this. But
Mm-hmm.
tamoxifen was the drug of choice. And even though I didn't have chemo or radiation, I still had symptoms,
Mm-hmm. Mm-hmm.
serious
When you
symptoms.
say symptoms, be more specific. Be more specific. Meaning
Mhm.
you had side effects.
I had
So
side effects.
you had nausea. Like, what did you have? I guess.
The
No.
first day I took it, again, I'm like, oh, this is fine. I'm good. The second day, I guess it got in my system. I felt like, not exaggerating, it felt like I was burning from my head all the way down to my feet.
Mm-hmm.
When I
Mm-hmm.
went to use the bathroom, I thought I had a UTI because it burned when it felt like when they put the dye in for X-rays. That's how
Mm-hmm.
it felt.
Mm-hmm.
I started sweat. I even took my temperature because I thought I had a fever. That's how hot
Mm-hmm.
my body was. It was controlling the hormones. It forced me into menopause.
Yes, you were
So,
having menopausal
ooh,
symptoms because of the
yes, it was
tamoxifen.
terrible. And then
Right.
after that, I had severe muscle aches. When I would get out of bed, I had to sit across my bed for a while because the aches were just excruciating. Um,
And so these are all for the audience. If you're out there, and again, let us know if you've joined us and where you're joining us from. But these are all symptoms of this hormone therapy. And what a lot of people don't realize is these are a lot of the symptoms because this is the other thing I talk about as women. No one told us about menopause.
right.
No one talked to us. We all got sat down and we were talked to about our periods. Well, not even all of us, some of
Mm-mm.
us, right? I was the only girl, three older brothers. And I don't remember my mom having like a full conversation. It was like kind of after the fact. It was like, oh, by the way, I got this sort of talk about my cycle, about periods. On the to the contrary, I remember being very proactive about talking about menstrual cycles and periods
Mm-hmm.
and how to prepare yourself and getting my girls ready. My first child was a girl, so I had a girl, boy, girl, and I even had a sort of this welcome to womanhood dinner for my
Mm.
oldest daughter, and she invited friends. I say that to say I remember celebrating the cycle, the period. But I
Mm.
didn't know anything about menopause. So I didn't
Yeah.
have any conversations with anyone about menopause.
My mom is very old fashioned and still today. I had to find out from girlfriends. She didn't talk to me about cycles. And you're right, they don't discuss menopause. So when those symptoms hit, I didn't know what to do. Like I said, I took my temperature, thought
we
I had a
are
high
we
fever.
are teaching right now, this generation. We are literally finally, I think, opening up
Yeah.
and being very open and honest about menopause and menopause symptoms. And one of the things, and the reason I'm bringing this up, is because the very symptoms that you had from tamoxifen, because it was, it's a hormone therapy,
Hmm.
you're explaining what a lot of people just don't know that happens with
Hmm.
menopause. So with menopause, not just the hot flashes, but the aches and the pains that you feel, the muscle aches, the joint pain.
Hmm.
They're talking. There's a lot of people who actually, women who have what they think is arthritis, right, in their joints, and it actually
Hmm.
turns out to be
Amen.
some of the aches and pains from menopause. But we've not been talking about it, so
Mm-mm.
we hadn't been prepared. So there are a couple of times where I thought I had arthritis, something's going
Mm.
on, and went and had conversations and went and talked to my doctor. And it was when I was perimenopausal, going into menopause. I'm like just knocking on that door. I almost can't wait to be done. But I have these hot flashes and things, but my mother never talked to me about this. So these
Um,
symptoms that you had are
mhm.
a lot like menopause. Like you said, it threw you right into
It threw
menopause.
me right into it. And then the other symptom that I didn't get, and again, I'm a jokester, and that's what one of the nurses, when I was getting prepped for surgery, and I was on my cell phone talking to my coworkers, and when she said, "Okay, it's time's up," and she said, I heard your conversation, I heard your demeanor, you were laughing, you were smiling, you getting ready to have a major surgery, and you act like you're ready to have your tonsils out. You have a good attitude, you're going to be okay. But back to that. I was on my cycle when I had the surgery.
Mm-hmm.
I
Mm-hmm.
was on my period when I had my mastectomy, and yeah, it stopped all that, and it stopped the cycles and everything, and also it helped. They said tamoxifen makes you gain weight, so that's what I told my doctor. When is it going to
Because
happen?
menopause makes you gain weight.
Well, I guess my stature and the way my body is, I didn't put on a whole lot of weight,
Yeah, yeah, you just
but
put
yeah.
on a little. I mean, and you're again fortunate, but again, these are the conversations that as women we had not. I had never had until it was
Mm-hmm,
happening, and I'm like, I've not changed my diet. I'm
mm-hmm,
just as active as I ever been. Where is this weight coming from? And everyone wanted to blame it on COVID. I said I can't blame it on COVID because I've been just as active in
active,
COVID,
right.
and I wasn't going crazy with my, with my diet. I wasn't
Mm-hmm,
eating a whole bunch of comfort foods.
mm-hmm,
So where is this coming from? And then I began really looking at the symptoms of menopause that don't get talked about. And the stuff
mm-hmm,
that we as women, for I don't even know what reason we're not sharing this information. It would be very helpful to say,
mm-hmm,
at around such and such age and stage, these are the things that happen. Now you got to work harder at
mm-hmm,
maintaining your weight. You're gonna have these, hot. I think the only thing I probably knew about were hot flashes. I
mm-hmm,
didn't know anything about the muscle aches and the pains and
mm-hmm.
the joints and the weight
Yeah.
gain. I didn't know any of this.
And when the seniors say, "Oh, it's going to rain. I'm going to ache," it did.
You can feel
Terrible
all
ache. Yes,
yeah, you can feel
very
all.
much. Mm-hmm.
Um, so how has your family and friends been so how have they been supportive in your journey?
Oh, very supportive, especially my daughters, my close girlfriends. They've been very supportive. And like I said, my niece was my medical advocate because the last doctor's appointment before my surgery, and when she said, we're not gonna do a nipple tattoo, we're gonna preserve it. And I looked and she said, "Why you look puzzled?" I said that last meeting. And I'm like, "No, you didn't." And my niece said, took out her notebook. Yes, she did. She said that at our last meeting. So I was tunnel vision because I'm thinking I heard everything this doctor said. No, I wasn't focused at all. So it's good to have
I was
someone with
I was
you.
gonna say, I'm so glad you just said that. That's a great tip for people. When we're in stressful situations, anything, any kind of stressful
Mm-hmm.
situation, um, you're never. I don't. You could be the smartest, most in-depth person, but you're never gonna actually hear everything that's said
Mm-hmm.
or remember everything that's said. And oftentimes we don't walk in with a notebook in hand, or even if we have a notebook and pen in hand, because it's happening to us and we're going through the emotions, we're not jotting everything down. This is, it's not note taking
Mm-hmm.
session for us. So we're listening. We may jot
Oh,
down
we're
a
not
couple of
listening.
important things that stand out to us, but it's so important to have someone with you
Mm-hmm.
who is focused on trying to hear all of it, trying to
Mm-hmm.
get all those details so they can be there with you, to say. And again, had you heard something and you said, yeah, you didn't say that last time, and they could have
Mm-hmm.
backed you up. Yeah, I didn't write that. I don't remember you saying it either.
Mm-hmm.
And I tried writing everything down, but it was good to have someone there that you trusted,
Mm-hmm.
that you could say, well, you didn't say that. And
Mm-hmm.
your niece could say, actually, Auntie, she did.
Mm-hmm.
I wrote it here. Now that makes you feel more comfortable, because sometimes, we do feel like, is someone trying to pull something over? Did they not say
Mm-hmm.
that? And then all of a sudden they're trying to cover it up and they're saying it now. Like, what's going on here? So that's good to know, or good to have you remind people that having
Mm-hmm.
someone with you is extremely helpful.
Extremely helpful.
Mhm.
Very. Mm-hmm.
So I was reading your bio. You were talking about, and have people talk to you. You had talked a little bit about your book really quickly, but you said that you use your personal mantra to inspire others. So can you share with the audience what your personal mantra is?
Yes. Yes. My personal mantra, and like I said, stated in my book, is my thing is aspire to inspire. And again, in the beginning of our chat, I said I used to cry every night. Why me? Why me? And then something just said, why not me? Be that advocate. So my mantra was accept your diagnosis. It's accept it, embrace it, and move on and pass that journey along. So that was is helping me to pass my journey along and my story to help others. And the reason why I wrote the book, because I've had like maybe 4 people say, you need to put that in the book because you helped me.
Right.
And
Right.
I
Your
didn't
story
see
is
it.
very impactful. Your story is very
Thank
inspiring.
you.
So I'm glad that you did put in a book. So tell everybody the name of your book.
Yes, it's called Within the Fire. I Found My Voice. It's a memoir. It's the last chapter definitely highlights me developing breast cancer while I was still in the job, and how the job helped me with my annual leave. And I mean, it was so much that needed to go on. Is again that medical or your person, family member helps you along the way because there's a lot that you have to embrace. And then I had 3 young daughters, so I had to worry about their feelings, and it was just so much. But it took me 2.5 years to write.
Mm-hmm. Mm-hmm.
But the ideology of writing the book came when I got diagnosed, when I was laying in bed, bandaged up. And to keep my mind sane, I would read my phone. And I used to read a lot of articles of other female firefighters that were developing breast cancer.
Mm.
And they were doing articles and this and that. And I'm like, I'm in the nation's capital. I was a DC firefighter.
You
I
were an
need to do
inspector,
something.
right?
Yeah, well, I retired as an inspector, but
Yeah.
throughout my 27-year career, I started out as a firefighter.
Mm-hmm. That's
And
amazing. That's
that's
amazing in itself.
where,
That's a book by itself.
yeah, it is.
That you were a
I
black
really
female
believe
firefighter.
that the carcinogens were a contributing factor because when I came on the job in the early 90s, the fire trucks now, they have the exhaust that hooks up to the tailpipe and all that. When I was, my station didn't have that. So those smoke and all that was just probably just sitting there floating in the air. And I didn't realize I was inhaling it. And and then going into fires. I was stationed in the Southeast, so I had plenty of fires that I went into. And that's why I was saying when I came out of a fire, the soot was in the grooves of my fingernails and I had to blow my nose to get the soot out. That never dawned on me that that probably was absorbing in my body.
Mm-hmm.
So my goal too is to, I would love to speak to other audiences, not just females, but female firefighters, not to scare them, but to show them and to be proactive
Bring
and tell them
awareness.
the things that I did wrong for them not to do.
Right. Just to bring awareness. And
Bring
and as
awareness.
you stated, aspire to inspire others to take care of their health. I think the other thing you're inspiring others to do is take their health, to be proactive about their health.
Yes.
You know, it's very interesting because I think it sounds contradictory to say I have a high tolerance for pain, but I
Mm-hmm.
didn't want to do that mammogram,
Mm-hmm.
right?
Yeah.
And that's very common, I feel, in the black community. I think, for instance, our black men are, they see themselves as strong and tough
Mm-hmm.
and they can take anything and do anything, but they're afraid to go to the doctor. So
Or
there's this, uh-huh.
they were taught not to cry.
Right, that's my point.
Yeah.
So the fear, there's this underlying fear of the things you just don't want to know because you don't want to have to deal with. So
Mm-hmm.
you'll deal with all the stuff that you know and that you have to deal with, but there's this something going on that we have to dismantle, um this this fear and this hesitation.
Mm-hmm.
um I think what blackdoctor.org tries to do is be very active, proactive in saying, having black doctors at the table,
Mm-hmm.
having black doctors be a part of the conversation, having black doctors advocate in our community will hopefully help that process, will
Mm-hmm.
help us talk about what we're feeling physically, mentally, emotionally,
Mm-hmm.
so that we don't feel somehow embarrassed or hesitant to
Mm-hmm.
talk to and tell our stories or give this information to someone that we know is actually really on our side and, and,
Mm-hmm.
and trying to help, correct or redirect or whatever it is, salvage situations. So that's why I love being a part of this amazing organization, blackdoctor.org, and bringing this kind of information to our communities,
Hmm.
because it really is important for us to
It is,
dismantle this, and
especially for
it has.
females. Yeah, I did a couple of speaking engagements 2 years ago, and my title of one segment was "Being on the Front Line of Your Health,"
Hmm.
and I talk about that, and I talk about the nutrition, like you said, and
So
what
I
we
was just about to
do.
say that. What did they tell you? Tell my pa
Um,
tell my because I write a lot, I talk a lot about plant-based diets, right?
mhm,
I talk a lot about decreasing, fatty foods, decreasing fried foods, and increasing fruits and vegetables in your diet. But in my book, I often talk a lot also about, I have a whole chapter on herbs and
mhm,
different spices and
mhm,
stuff that's actually good for you. Like people who are struggling with, diabetes should put
mhm,
cinnamon in their diet, right? Because it
mhm.
lowers blood glucose. But what did they tell you? What are some of the things they told you about breast cancer to start incorporating into your diet?
Again, like I said, when I did that speaking engagement, I had a PowerPoint and I listed some of the things that they said in my chart, and it was dark green leafy vegetables,
There we go.
um,
Antioxidants, guys.
antioxidants.
Everything you need
Yes.
to know. So dark leafy
Hmm.
green vegetables. Did they talk about like berries and things
That
that are
all the
dark?
berries. Yes, all
Yes,
the
yes.
berries.
Again,
I'm trying to think
antioxidants.
some of
Um,
the nuts. I can't remember
yeah,
which nuts they
probably some
said.
almonds, some walnuts. Like those
Yeah.
things are really good for you. The other thing is to know is what's anti-inflammatory, right?
Yes.
Because turmeric and things like that are
I was going to say that.
anti-inflammatory.
That was the number one
Whereas,
spice
yes, I was going to
that they
say
said. That was the
turmeric.
first thing on my chart on the spices was turmeric.
I put turmeric in everything. It don't even need to call for turmeric. You're gonna find my. You're gonna be like, why is
Mhm.
this so yellow? Because I put
And
turmeric.
I'm still, can you believe, again, we're our worst enemies. I still
Have
dabble
a
with the
hard
turmeric.
time.
Hmm.
Embrace it. Embrace it. I promise you, you'll love it. You'll love it. I make turmeric shots. I make them turmeric and
Mm.
lemon ginger shots. They're in my refrigerator. I make them all the time. I juice with lots of dark green leafy
Yeah,
vegetables. So
that,
I
yeah.
juice with kale and spinach and all
Hmm.
kinds of things. So I'm trying to tell people you can take control, and this is preventative as well
Hmm.
as once something does happen, you're helping your health and on the
Yeah.
other end. This helps on both sides.
Now, one thing
Mhm.
that I didn't mention when I was in firefighting, the one thing that they said feeds the cancer cells. Of course, I didn't know I had cancer cells. I used to drink 6 sodas a day.
So come on now. I was about to say the thing that's inflammatory is sugar.
I used to drink.
That sugar is so inflammatory, and the way we consume sugar is in
Hmm.
sodas, pastries,
Hmm.
just sweet teas. There's so many things that people are consuming on a daily basis. I was
Hmm.
I was literally about to say the sugar part, so I'm so glad you said that. But to
Hmm.
know that 6 sodas a day,
When I was in
I
the
don't even know.
firehouse,
I don't even know how that is.
I
Yeah.
used. Do you know I still have a problem drinking juice because in the firehouse I drank a soda, a Coke with breakfast. So when I
Mm.
had to wean off, the doctor said I will really be weaning off like a an addict. I had to slowly wean off of it. And I can remember one time at work, one of the guys asked my lieutenant, can she please just have one soda? Because she's very irritable. And I didn't even realize I was going
Oh,
through withdrawals.
sugar is a drug. Sugar
Yep.
is a drug.
Hmm.
I'm so glad you said that. So I mean, I talk a lot about the title of my show is Mind, Body, and Stress, and I talk
Hmm.
about the stress piece because the thing that first of all they're all connected.
Hmm.
Are being stressed out, the stuff that you're thinking about, your body, and then all of that stuff is feeding back. And so how we're eating,
Hmm.
how we're managing that stress. I talk a lot about meditation,
Hmm.
walking, exercise, but
Hmm.
nutrition is just such a big role, plays
It's
such
a
a big
big
role.
role. Yes.
So I'm so glad. Thank you for being on the show today and
Thank you.
sharing your story and inspiring us. Where can they get a copy of
Yeah, this is the book.
Within the Fire? Guys, again, this is a Black female firefighter. This is someone who telling us her story. And where can they get a copy of the book?
Amazon, I don't know if they can, well, it's the Q code. I don't know if they can
I
copy
mean,
it,
what
but
we can do is maybe list
yeah,
that on the website at some point. But
yeah,
it's called
but
Within
it's
the
Amazon.
Fire. It's on Amazon, called Within the
Hmm.
Fire. And this is by Ruth Redmond. And I always end my show with what I call one of Dr. Yolanda's plan for keeps. I have a whole card system that I put together. And I
Hmm.
pull a card each month for something for you to do for the week. So the one I pulled for us was the four of spades. So the spades usually some kind of activity to do. So we have create mindful minutes each day this week. Mindfulness is the mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, and is used as a therapeutic technique. This is slightly different than mindful minutes, which are minutes that you identify throughout the day where you maximize your mental and physical capacity. An example of this is to get down on the floor while you're watching TV anytime this week and position yourself in a straight plank. It's almost like a push up, but you don't push up and down, you just stay up in a plank. And you want to do this for at least a minute during your commercial break. Another similar example of this is to do squats or push ups during a commercial break. These minutes can also be taken away from home. For example, trying to do arm curls with some kind of resistance while waiting in line at the bank, or try lifting your canned beans or vegetables while you're waiting in line at the grocery store. I often will lift my basket when I'm standing in line. I make sure if I'm not going to buy a lot of stuff, I don't do a push basket. I get a carry basket, and then I switch arms while I'm in line, and I use it to actually work out while I'm in the grocery store. You'll be surprised how many minutes we spend idle and or sedentary, and the opportunities that you'll find to exercise if you just put your mind to it. So this is your way or my way of creating mindful minutes throughout the day. Not necessarily mindfulness, but identifying minutes to be mindful of having some kind of physical activity throughout your day. So I want you all to have an awesome day on purpose. Thank you so much, Miss Ruth Redmond. She's
Thank
actually a
you.
cousin of mine, y'all. So I had to have her on the show today. Um, for sharing your story and
Hmm.
for aspiring to inspire others with your story. And
Yes,
again, get checked, everyone. Do
yes, please.
your yearly exams. Start getting your mammogram. Sometimes, many of us have been. It's been suggested that you start at age 50, but we actually suggest starting earlier than 50,
Hmm.
45 for those who may have family history of any kind of breast cancer. Obviously, if you have any kind of symptoms, then you can get checked right away. Just let your
Hmm.
doctor know that you want to be checked. Um, and I just hopefully this has been helpful to you all. It's been very helpful to me. And we wish you all the best. The
Hmm.
book is
Thank you.
called Within the Fire. You can find it on Amazon. The author is Ruth Redmond. And I hope you all have a wonderful day, a wonderful rest of your week, and make sure to make October, the best it can be. Find out as much as you can about breast cancer, be aware,
Hmm.
make others aware, and just be a part of this aspiring to inspire others. Thank
Yes,
you.
thank you.
All right. Have a good one.
You too. Thank you.